bright and early. Thanks for tuning into the Breakfast Club. I'm Kritsween Valian. This morning, viewers, we go all the way back to the big health debate brewing across the world. And this one's caught everyone's attention because it revolves around paracetamol, an over-the-counter drug all of us carry in our handbags, office bags, even travel bags, is perhaps in our bedroom side drawers as well. So we'll talk about that, the latest comment that's come in from US President Donald Trump, how much truth really is there to that big claim. And then we talk about the response that's come in for the new guidelines issued by CBSE for class 10th and 12th students. One of the many rules include a mandatory 75% attendance. Is everyone happy about this? Surely a much needed push for discipline, but what does it mean for those giving competitive exams and overall well-being of the students? That interesting conversation coming up with school principals and students in just a bit. First up, a quick check of these two headlines. We start with the paracetamol debate as it heats up amid autism claims that have been made by President Donald Trump. Millions take paracetamol safely. Why is there so much panic then over its usage? Science says only one thing, the social media conversation talking about the other aspect. Why are doctors pushing back on this big scare coming in? And most importantly, is paracetamol safe in pregnancy? All of those questions will be answered by top doctors joining us in just a bit. And while CBSE has made the 75% attendance mandatory for board examinations to sit for the exams to begin with, no internal assessment, no result is what CBSE rules say. 2-year study is now mandatory for class 10th and 12th students. We'll talk a little bit about what that really means, what these stricter rules means for students, especially the ones also giving competitive exams. How are they taking this? How is the school coping with these new rules? That conversation coming up next. But first, there's a new health talk making global headlines, and this time it's about paracetamol. It's the same pill millions of pregnant women and others take for a headache or a mild fever. And suddenly, it's being blamed for autism in children. Not just that, vaccines being given to children early on is also being blamed as much for autism. All of this based on a set of studies that are now being misused, misread and misquoted by some influencers and by people in charge of public health policy in the US. But what's the science really saying? Are these claims backed by any serious medical consensus? We're doing this story because fear travels faster than facts. And it's important to ask this morning, what do we actually know? What is the real truth? So before the WhatsApp forwards run away with the narrative, let's get you the truth. Here's a quick explainer. We break down this story on how the paracetamol autism scare began and why experts and scientists across the world are calling it a dangerous distraction. Take a look.
America's new public health policy isn't coming from scientists. It's coming from conspiracy theorists. President Donald Trump and his health secretary Robert F. Kennedy Jr. are now linking childhood vaccines and paracetamol to autism without a shred of credible proof. And they're not just saying it, they're making it federal policy. This began with a press conference at the White House.
I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, it's fight like hell not to take it. There may be a point where you have to, and that you have to work out with yourself. So don't take Tylenol. Don't take it. Don't take it.
Trump also said that vaccines, especially the MMR triple shot, should be split up or delayed. Why? Just a feeling, he said. No data, peer-reviewed science, but just a feeling. The heart of this policy shift is RFK Jr.'s MAHA movement, short for Make America Healthy Again. It's a mix of anti-vax beliefs, raw food culture and wellness pseudoscience, now promoted as US health doctrine. RFK Jr. now oversees a $2 trillion federal department with over 80,000 employees, and he's rolled out the MAHA report, a 300-page blueprint warning against vaccines, pesticides, psychiatric drugs and paracetamol.
First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good.
Medical experts say some studies cited in the report don't even exist.
Good afternoon, everyone.
Even the White House press secretary later admitted that the data was flawed. But the administration stood by the report anyway, calling it one of the most transformative health documents ever released. Let's take a look at the actual evidence. Several studies have suggested a correlation between paracetamol or Tylenol use during pregnancy and autism. But correlation is not causation. A landmark 2024 study in Sweden tracked 2.5 million children. They found no causal link. In fact, when they compared siblings, one exposed to paracetamol in the womb, the other not, any link disappeared entirely. UK, US and Australian guidelines continue to recommend paracetamol as the safest painkiller during pregnancy, because the real danger is untreated high fever, which can cause birth defects, miscarriages or low birth weight. So why attack paracetamol? Autism rates in the United States have risen from 1 to 150 children in 2000 to 1 in 30 today. But the reasons are complex. Evolving diagnostic criteria, better screening, more awareness, genetic and environmental overlap. Experts say blaming medication taken during pregnancy without any evidence only stigmatizes mothers. It shifts the burden of proof onto them and ignores the overwhelming genetic contribution to autism. Medical bodies around the world, from the FDA, CDC, NHS to Australia's TGA, have rejected Trump's claims. But the damage is already done. Kenvue, the maker of Tylenol, lost $2.6 billion in market value overnight. The FDA will now issue a warning label despite the lack of causality. Doctors say public trust is collapsing and vaccine hesitancy is surging again, just as measles outbreaks are rising in the US. A scientific consensus built over decades is being undone in a matter of weeks.
It is tragic that we see this vaccine skepticism, because even though the number of additional deaths in the rich world is likely to be modest, every life should count. And when the poor countries hear that skepticism, it spreads there as well. And there, the chance of a child dying when they get measles is about 30% versus about 1% in rich countries. And so tragically, that skepticism, which is not well-founded, will have caused more deaths outside the country than inside the country.
So with RFK Jr., you've agreed to disagree?
On vaccines, yes.
Well, let's now go across to our experts, our doctors joining us this morning. First up, Dr. Hema Devakar, Medical Director, Senior Consultant, Obstetrics, Gynecologist, Well Women Healthcare, FIGO, is with us. She joins us from Bengaluru. Very good morning, Doctor. Thank you for sparing the time. Also with us is Dr. Vivek Jain, Senior Director of Pediatrics at Fortis Hospital in Delhi. Good morning, Dr. Jain. Let me begin with the lady here, Dr. Hema. Let's talk about this first sound that's come through via this big headline. A world leader says, pregnant women should fight as hard as possible before taking that paracetamol that's lying in front of you. Like I said, it's one drug we all carry in our handbags, office bags, perhaps, bedroom side drawers as well. But with someone like him making this kind of a comment, what's your first analysis, first thought as a medical professional, not as a politician or perhaps as people like us who are out there to judge and perhaps confused?
Good morning, Christine, and thank you for calling us on the show, which really brings forth 2 points. One is even if it's a paracetamol, don't take it without doctor's guidance. So that's a general message for everybody. And the pediatrician colleague is here, and more will be known about autism. So it's a kind of an indirect awareness program. So that's we are good to go. The medical fraternity, it's not only us, but also the pregnant woman herself and the entire family and her friends who are very, very, very guarded on their own about anything that they do. It's not only as simple as taking the paracetamol, for example, but also, should I lie down to the left and sleep? Can I travel by auto rickshaw? Can I can I eat this or that? So for almost everything, because pregnancy and anxiety are like two sides of the coin, as in today's era, so everybody is worried about doing one thing or the other. And definitely the way the viral infection spreads, the viral news about the paracetamol and the pregnancy. Can you just imagine how many calls and how many messages I must have got since the last 24 hours? Because so many of our pregnant patients in the last couple of months, when the infection is in the air and the high spikes of fever are there, and we have to give them the drug and they've already taken it, you can imagine their mindset today. Oh God, what will happen to my child because I've already swallowed the paracetamol? This is the level of anxiety which is rising. And to place it in the proper perspective, Kritsween, it is that when it's needed, we as doctors think paracetamol is the safest thing to give, because high fever is really not to be left untreated. The infection which brings about the fever, we always ask the patient to monitor the temperature, and only if it rises about certain level, we tell them, okay, now you can take the paracetamol, but not treating the fever. This is a very, very important point. Being scared and not treating the fever can cause many more problems, the miscarriages, the premature deliveries, the high spike of fever early in pregnancy, for example. That itself can disrupt the organ formation and bring with it lot of problems for the children. So everything needs to be guarded, and as a general rule, which our pregnant patients, rural or urban across India, there is one thing in pregnancy that they do. They are always checking with the medical professionals, and if we do not speak with conviction about what the science says, I'm sure these confusions and anxiety will only escalate. So,
well, Dr. Hema, you
Yes.
surely know your patients really well, and you seem to have a lot of faith in your patients. So we're going to go by that, and we're going to assume that that's what people are doing overall, especially pregnant women, given how concerned they are, how careful they are through and through their pregnancy. Dr. Jain, can I come in and ask you this then? Tell us a little bit. Separate, the facts and these big claims being made for us then, because this world leader has very conveniently gone on to link paracetamol and also vaccines being administered to young children as directly linked with autism. Now that's a big claim in itself. Tell us what science, research, etc. has laid out for us, and where does that leave us today? Do we conveniently put this aside and move on and say, no, enough has not been researched on this, these are unproven claims still, let's not worry, let's not fearmonger, more importantly?
So thank you, first of all, Christine, for inviting me for this show. So I would want to just first of all upfront say whatever claims have been put across by Mr. Trump, there has been no scientific, robust data available to support it. And even the White House, as we have seen the report, has claimed, it's there's no real data available as of now. And fortunately, most of the World Health agencies, whether it is WHO, whether it is European medical agencies, they have all come up with support to this claim, against it. So when we talk about paracetamol, and as our obstetrician colleague has already cleared this doubt, there has been no relation whatsoever. It's just that because of such claims, there can be a lot of fear amongst general population. And think about the parents who are dealing with their children already having autism. Now they will go back to those data. My gynecologist gave me paracetamol during pregnancy, and that led into this issues. So far there is no data to support it, and I can safely say that paracetamol is one of the safest drugs which we have available right now in the world. Imagine a lady is going through pain and we can't use paracetamol. So they'll end up using something which is more dangerous, which can be more harmful, whether it is stronger painkillers or stronger, analgesics, or sometimes even antibiotics. So yes, clearly, I would say that we should be a little mindful without taking this claim on face value. But fortunately, most of the evidence is against it. Now, coming to the next point, which is very, very, very important from a pediatrician's perspective, is the vaccine claim. So, when we talk about vaccine is one of the most important, I would say, a move which has happened in last 50 years, which has saved a lot of lives across the world. So, just to put across the data, so every year we save as many as 50 million kids due to vaccine preventable diseases. And we, as the developing nation, are the major sufferers because of most of these vaccine preventable diseases happen in our country. And there is already a lot of vaccine hesitancy because of various, so-called Instagram claims or so forth. So, certain influencers who are talking about vaccines. So if something like this comes against vaccines from somebody of that authority, it makes things much more difficult. So
just speaking logically, Dr. Jain, correct me if I'm wrong. For instance, in the case of autism here, isn't autism also diagnosed at around the same time? For children, I'm speaking of children here. At the same time that their routine vaccination also takes place. So linking the two, the sound of it is quite bizarre, isn't it?
So definitely, yeah. So you are correct. Actually, the autism is mostly diagnosed between 1 to 3 years of age, and obviously we are seeing a lot of rise in cases of autism, and it is mostly related to a better diagnostic tools available. It's nothing to do with that there are more vaccines available, there are more medications available that is leading into more autism. So yes, as you said, it is very, very scary. Autism is something very huge. And if you say anybody that the vaccines can lead into autism, parents will be thinking twice before coming for the vaccination, and that will lead into a significant rise in these vaccine preventable diseases. And if we talk about just one disease, which is measles, so we lose as many as 5 million. We used to lose about 5 million lives every year just because of vaccine preventable disease. And if the measles outbreak happen again, we'll start losing another 2-3 million lives just because of single disease of measles. And most of the claims have been against the MMR vaccines. So there has been enough robust data available. So I would want to tell to your audience through this medium is that MMR, the one vaccine which is thought to be most notorious, it is one of the most important vaccine. And there has been no data across various multi-centric, multi-trials. There has been no data to support that MMR leads into autism.
Okay. You've put it out very brilliantly, and you've really cleared out some of those doubts perhaps parents watching this are going to be looking at in hindsight. But Dr. Hema, to really take this point forward and go back to the drawing board, and all those wondering then, how is it that so conveniently, while citing some quote-unquote evidences, a world leader that enjoys the kind of status he does is made this statement so conveniently, passed it off and put the blame solely on some of these medications, some of these vaccines. Tell us a little bit about the story then, and let's go back to the fetal stage. What are these factors that play an important role that could lead to autism in early years?
Yeah, sure. This is a very, very important question that you raised, Kritsween. The two words which are making the rounds are association and causation. And then it can be even more confusing if the explanation is not clear. For example, the simplest thing, looking at you, I can say that if Kritsween was born fair, we have to presume that she will be tall, because fairness and tallness are associated with each other. Can we say that? No. When the child is born fair, it depends on the genetics of the parents, it depends on the nutrition, it depends on the lifestyle, it depends on the infections that the child has battled with, it depends on so many other things which will make the child short or tall. So these is associations, and it is not that the fairness is the cause of the tallness. So that is the kind of simplistic explanation that we may have to give to the lay people. But what causes autism, if at all it does, is paracetamol, what the science is trying to tell, is not the cause. It may be incidental that she has taken it, but did the women have the genetic potential to unfold the autism in to the fetal formation, whereby the early childhood and infancy, these will be manifest as how the pediatricians will try to diagnose and hit upon something that they need to act upon. Then there could be the women's age, whether she had fever in the early part of the pregnancy, which itself may be a disruptor of the organ formation. Then the exposure to several other toxins, the lack of taking folic acid, which is again something that every pregnant woman or those who are planning to be pregnant should and must take, because the neural tube defects, this is a very strongly evidence-based given all over. So this is something that actually they have to take across the counter, because that's a useful thing to do. So there are several factors which may lead to autism, and you cannot place your finger that this woman has taken paracetamol in whichever month of her pregnancy for whatever length of time, and therefore the child has been diagnosed as autism. That is absolutely incorrect, as how the scientific evidence also says there may be a causal association but not cause and effect, as we would scientifically call it. So there are several studies which have refuted already, but there's one single study on which this announcement has been based, and the largest study done in Sweden also endorses. There are millions of women who have been taking paracetamol, and retrospectively, if you look at autism, paracetamol, pregnancy, the treatment, as it is as a general rule, we as OBGYNs will give the paracetamol for the shortest possible time, only if it is needed, and justify the use of that for the primary problem for which we are giving, high fevers, infections, and that needs to be given. So this kind of a scare, whenever it's needed, also if the patient doesn't take, then it's going to be a disaster.
And I can't help but
warning.
highlight that time and again, the possible dangers that come with untreated fever. You're telling us, Dr. Hema, that's much more, the magnitude of that is much more than possibly taking 1 dose or 2 doses of paracetamol, right?
Yes.
That's one thing that
absolutely.
everyone watching this must remember. Do not get scared because of what you're reading, what you're hearing, what your social media reels are telling you before taking a paracetamol. Remember that you got to follow your doctor's instructions, and if in doubt, reach out to your doctor. Right, Dr. Hema?
Absolutely, absolutely. Because being scared and not taking it can cause more harm when it's actually needed to be taken. And that does not mean that indiscriminately they must just pop a pill, which our pregnant women, by the way, most certainly never do. Because even for every little thing now, they can connect with us through the digital platforms. We are always available 24/7, and they do. Any which way the news they hear in pregnancy, they'll always want to double check with the healthcare providers, and that's a good thing, because then we need to be balanced and mature and reassuring in the way we guide them, and certainly we will do that job to the best of our capacities.
Lovely. Dr. Jain, have those questions come in from parents already? Have they been speed dialing you and really asking you whether or not they should watch out before giving a paracetamol to their child? Or as a thumb rule, parents, at least the ones who are coming to you, for their children, have known by now that there are a certain safe medicines that are going to be needed, that are going to be given to their children in times of need. For instance, a mild headache or fever, for instance. Tell us a little bit about your personal experience here.
So, fortunately, Mr. Trump hasn't made claim about children taking paracetamol so far, but you never know what's coming up. So, yes, a lot of our ladies, because we come across with children having autism also in our practice. So a lot of the parents have been asking me this question already in the last 24 hours about the autism and the use of paracetamol in pregnancy. But mostly the people are asking about the vaccine safety. So I have to put in that extra effort to reinforce the things to these parents, that because he's already made a simultaneous claim about multiple jabs and MMR vaccine safety, which creates a doubt amongst people about the vaccine safety. So yes, paracetamol, if I tell you honestly, we have been writing it to our patients, and it is a medicine, I would say, very confidently, it's one of the safest drugs we use in our pediatric population, and a very important one also.
But there are risks of overuse, right? I think there's consensus on that, and that comes with any drug, not just paracetamol.
Absolutely. That's true with water also. If you take excessive water, that will harm. So paracetamol we should not use, which I tell my parents कि बच्चे को सो बुखार है तो paracetamol दे दे. No, that's not recommended. Paracetamol is to be used when the child is in discomfort or for high fever to comfort the child. It is not that child is you just give round the clock paracetamol or you give double the dose, it will work better. So there is a recommended dosing schedule which goes per the weight of the child. There is a recommended maximum dose. If we use paracetamol more than the maximum dose, then that can definitely lead to liver toxicity and hepatic issues. There's no doubt about it. But when the recommended dose as prescribed by your pediatrician, paracetamol is a very, very, very safe drug to use.
Okay, and a last quick tip from Dr. Hema as well. You want to come in on that, Dr. Hema? When would you ask your patients or anyone watching this looking at a quick fix from a gynecologist on when they should go for that paracetamol, if at all?
As how I have already outlined, the drug when it's needed, it is to our discretion that we prescribe. And when she runs high fever, pain, infections need to be treated with the SOS instruction of the paracetamol, we do give it. And one more thing I just would like to add about the vaccines, we are so proud of our immunization program in the country with the UWIN app and with the follow-ups being very, very robust. And let's not allow the hesitancy to creep in now and cause the damage to a large extent, because the negative news, as you know, Kritsween spreads really well. So still the bottom line for us on paracetamol would be that yes, even as doctors, we will not be casual about the use of any drugs inclusive of paracetamol, and we'll just not say, okay, ye fever hai to le lo, do char rakho, as you said in the past. Not in pregnancy. Pregnancy, we are anyway guarded, but there are times where the patient needs, we use our discretion, and as I said, the minimal dose, shortest possible time, and she's over the crisis and all is well.
Okay.
But those who have already taken paracetamol in the last few weeks, you can imagine their plight today, how anxious they cannot now remove the drug from the system. But let me reassure them again that you have nothing to fear, because you would have taken instructions from your doctor, and I'm sure that all will be well with your pregnancy.
Thank you, Dr. Hema, Dr. Jain, for that reassurance. Very, very important in times of social media and the kind of trigger that it really leads to every time somebody, a big face who enjoys a certain reputation, comes out, makes these big claims. One is bound to fall for it. But thank you for telling us that there are wonderful doctors out there who are going to take in your queries, who are going to prescribe the right medicine for your body and for your child. Thank you for joining us this morning. We head into a very short break with that. On the other side, we shift our attention to the latest guidelines issued by the CBSE, one of which is 75% attendance that's been made mandatory for class 10th and 12th students. Coming up next is a very interesting panel. We'll be right back.